everyone. Welcome to week number 3. This week we're focusing on the ears. So last week we learned about eyes, now we're learning about ears. And this week we really only have one chapter to discuss. And we're going to focus on chapter 39, pages 895 to 902. So when we talk about chapter 39, what we're doing is we're looking at the study of hearing, which is known as audiology. The providers that work and specialize in this are called an audiologist. And it's important to know that the ear is actually an organ that is not only used for hearing, but it's also used for balance. Most parts of the ear are internal and are protected by your temporal bone of the skull. There are some instruments that we use within the medical examination of ears, and those are your otoscope, tuning fork, and odometer. An otoscope is a lighted instrument that we use to examine the tympanic membrane. A tuning fork is a metal fork-shaped instrument that produces a vibration when it's struck. What we will then do is take that vibrating instrument and hold it either up against the patient's ear or place it on their forehead or the top of their head to see if we can give them a rough hearing assessment. They should be able to hear the buzz of the vibration. And the last one is an odometer. This is an electronic instrument that is used to measure more frequencies or the number of fluctuations per second of energy in the form of sound waves. So what happens is a patient will have hearing earphones on, and they're going to see if they can have that ability to hear the sound in either one ear or the other, or both ears. And they'll raise their hand when they hear it, on what side that they hear it on. Every time the patient indicates their ability to hear a sound, a recording is made on an audiogram. So now that you understand the different techniques for how to test for hearing, there are a few more things that medical assistants are responsible for. We're also responsible for ear irrigations and ear installations of medication. So just like the eyes, but now for the ears. Now it's important when you're documenting that you use the appropriate abbreviations in regards to the ears when applying the medication or irrigating it. AD is what we use for right ear. AS is what we use for left ear, and AU is what we use for both ears. So now let's look at the procedure for ear irrigations and installing ear medications. So when you do an ear irrigation, we do this because it's necessary to remove any impacted earwax or serum. What you will use is just warm water in a syringe, and you're going to insert that into the patient's ear to help get behind the earwax and push it out with that warm water. In order to do so, you're going to have access to the patient's ear canal. Now this is done by pulling on the patient's ear lobe. For your patients who are 3 years or younger, what you're going to do is you're going to take their ear lobe on the bottom and you're going to pull down and to the back. Now if they're an adult patient or 3 years or older, you're going to take the top of their ear and you're going to pull up and to the back. This will help you have access to that ear canal. And what you'll do is you'll just push the fluid or the warm water into the patient's ear and have them kind of tilt their head so any earwax that falls out will be caught into a basin that is kept at the base of the patient's ear. When you're installing ear medications, we do this as either a way to instruct the patient on how to do it or actually putting the medicine in the first time for them. What you'll have the patient do is you'll have them either tilt their head away from the affected ear or lie on a table with their affected ear up. Again, you'll need to pull on that ear lobe to have access to the ear canal. So again, if they're 3 years or older, you're going to pull up and back. 3 years or younger, down and back. you really want to avoid touching the dropper of the medication to the patient's actual ear canal. So really place it about a ½ inch up as well. And then you're going to place in the appropriate amount of drops that were ordered by the provider. To actually receive the best results, you want patients to leave their head tilted for about 3 to 5 minutes, just so that medication has a way to work into the ear canal as opposed to sitting right back up and it will come back out of the ear. Alright, so this week is a very brief overview for you, not very many pages and only one little chapter. So I do highly recommend that you do read your chapter. Please make sure that you do this because it will help you not only for my class doing your discussion posts and your quiz, but it will also help with your lab class for this week and the procedures that you'll be responsible for. When we talk about your discussion post for this week, it's focusing on hearing impairments. You're really going to need to discuss whether people with hearing impairments can actually compete and work in fields such as technology or scientific fields. You'll need to explain why they can or why they cannot. You'll also need to go into some explanation of some challenges that people with hearing impairments may face, and what are some resources or tools that they can use to help them along the way. Please make sure your initial discussion post is completed Tuesday by midnight, and that your 2 classmate responses are completed Saturday by midnight. Also this week you will have a quiz again, and this week's quiz is based on the chapters we learned last week, so those about the eye, and this week, so those about the ear. So weeks 2 and 3 are combined in this quiz. It is a 10 multiple choice question quiz, and you will have a 10-minute time limit. Please make sure that you plan appropriately and give yourself the amount of time. This is an online quiz, so it will be needed to be completed by Sunday at midnight. Any questions that you guys have along the way, please make sure that you're shooting me emails or calling me, and I will always help you along the way. Have a wonderful week, guys. Bye-bye.